Okay, so you may have low progesterone. Low progesterone is a really big deal today. I see a lot of women, even in a younger age, struggle with low progesterone. And really why I want you to know it's so serious is because it's really tied to fertility. Progesterone comes from progestation. So a lot of women struggling with infertility and irregular cycles or struggling during their pregnancy often can come from low progesterone. Low progesterone is actually the #1 reason women miscarry, and miscarry is a tragedy. It's sad how prolific miscarriages are today. And so I really encourage women, if you find out that you have low progesterone, you really, really want to do something about this. Regardless, if you're thinking about having a child or not, but especially if you're considering getting pregnant, you already are pregnant. I usually recommend women work on their progesterone between pregnancies, but absolutely take something even during a pregnancy just to ensure that everything's going to be okay through the pregnancy. Because again, it's so profound today for women to be struggling with this issue. You just don't want to take any chances, especially when you're talking about a life, like your baby's life. So what can you do if you have low progesterone? The easiest way is just to take a straight progesterone cream, and the one we use is by Proferia. It's Arthur Andrew Medical, and you can put this cream right on a vein. So you can actually put it in the vaginal area, you can put it on your neck, you can put it on the inside of your thigh, you can put it on your wrist, and you want to alternate the different places that you take it, and there are instructions on how to take the progesterone cream. So I really recommend the Proferia, again, if you've ever had a miscarriage, if you're planning on getting pregnant, or even if you are pregnant, just to ensure safety, at least through the first trimester. But I usually encourage women in pregnancy to take it throughout. A good midwife or doctor should be checking your progesterone levels just to make sure they're okay. Also, when it comes to progesterone levels, understand that the best way to check those is through saliva, not blood. Saliva tells you the active available progesterone in your body, where progesterone checked in blood is actually already bound to a protein and either used up or being used. So it's really important that you understand that about progesterone as well. So we talked about the Proferia, which is the progesterone cream. There's a product by WishGarden called Progesteronic. Now the Progesteronics, what you want to take just to naturally increase progesterone levels over time, whereas the Proferia is like the progesterone cream that works immediately. It's good to take both because one is you're getting the progesterone, especially if you're pregnant and you want to prevent miscarriage, but also you might want to take the Progesteronic so that over time you're naturally increasing those progesterone levels. Has herbs in it like chaste berry and other herbs that naturally will increase progesterone over time. Another good product is Healthy Pituitary. There's a strong link between the pituitary and the production of hormones, especially fertility-related hormones like luteinizing hormone, follicle-stimulating hormone. The pituitary produces a lot of hormones that are tied to adrenal function. And as we know, the endocrine system is just this symphony of hormonal production that all works together. So supporting the pituitary also very important for progesterone production. Magnesium. Minerals in general, super crucial for hormone function and hormone production, but magnesium being the most profound. Not only does the body use minerals for cellular function and for hormone function, but the magnesium is really good for the adrenal glands, for calming and relaxing the body, relaxing the nervous system. And adrenal dysfunction can also be linked to some of these hormone imbalances. So the magnesium is super crucial by itself. I love the Health and Wisdom Magnesium Oil, which is like a foot soak. And you can soak your feet in that every night before bed. You can also rub that topically on areas where you're having cramping or discomfort. Great for women's menstrual cramps. So I really like the straight magnesium chloride oil as far as the foot soaks go. But another great way to do it is I want to mention these minerals by a company called BioCyan. And they have these minerals that are 0.9, which is called an isotonic solution, and then they have another one called a hypertonic, which is a 3.5 solution. You can start with the 0.9 and work up to the 3.5. The 0.9, what they are is they're ocean minerals. And just to give you the quick story on it, is ocean minerals have the same mineral composition as human blood. So it's good to start with the 0.9 minerals. It's a more diluted solution, and after a month work up to the 3.5, which is a 4 times stronger concentration. But there was a researcher back in the late 1800s, his name was René Canton, he was French, and he discovered this strong link between women's health. He specifically worked with a lot of women with fertility issues, with children being born with deformities and other issues. And he would start giving women these ocean minerals, and the studies were amazing. The issues all corrected themselves. Women who had fertility issues started having children. Women who were having children with deformities and other issues started having healthier children. And so it was amazing what these minerals do to strengthen the blood, to rebalance the chemistry inside the body, and also, again, to help with healthy hormone production, again, specifically here, progesterone. So those are the list of supplements. You might talk to somebody about specifically which ones would be best for you. Again, it depends on your situation, what's going on with you health-wise, if you're having fertility issues, if you're pregnant, if, you know, there's all kinds of various factors involved. So those are the different recommendations. I definitely would recommend the minerals as a baseline for anyone, some magnesium oil foot soaks, the BioOcean minerals, and then maybe a progesterone cream or the progesteronic, again, depending on where you're at related to pregnancy. The last thing I want to mention with progesterone is a lot of times low progesterone comes from liver issues. The liver is strongly linked to hormone imbalances, especially with women. And if the body can't filter out used up hormones, they stay trapped in the body, and they cause a lot of these symptoms related to hormone imbalance. So the ability of the blood to be clean and flowing and healthy, which is tied to the liver's ability to do what God designed the liver to do, is strongly tied to these hormone imbalances. So I always encourage women with low progesterone, low estrogen, a lot of these issues, to work on the liver simultaneously. I didn't give liver supplement recommendations here. I'm really focused just on the progesterone here of things you can do, but also consider a liver cleanse or working on your liver as well. So that's it for low progesterone. Hope it helps.